You're listening to a brief excerpt from Creating the Hospital of the Future through the Accreditation process, sponsored by DNV GL Healthcare. This webinar discusses how hospitals can leverage the accreditation process to improve their operations and quality of patient care.
Hello everyone, and welcome to Creating the Hospital of the Future through the Accreditation process, sponsored by DNV GL Healthcare. I'm Ron Schenkman. I'll be moderating today along with Joyce Scott, and we're very glad that you could join us. We're pleased to welcome our speakers, Patrick Horn, President of DNV GL Healthcare, Jose Perdomo, Senior Vice President, Chief Ethics and Compliance Officer for Nicholas Children's Health System, Marisol Castro, Director of Accreditation and Regulatory and Environment of Care, also for Nicholas Children's Health System, and Neil Salem, Chief Executive Officer, NISA Solutions.
Patrick Horn will be our first speaker in this session on creating the Hospital of the Future through the accreditation process, with some insights on accreditation and particularly how it might apply in a pediatric session.
Thank you, Joy. Yes, it's really kind of a great opportunity for us to highlight Nicholas Children's. We have worked with hospitals around the country, really around the world for that matter, and we've seen some extraordinary kind of things that come up for these hospitals. I think one of the very neat things that we've seen is looking really kind of at the innovative practices that we see that really kind of evolve from these hospitals. And I think Nicholas Children's just really stands out to me above so many others in that this is first driven from a culture, CEO on down, and then you can really feel it with the staff and the level of engagement that they've got. This is a hospital that is really focused on excellence, really innovative in the care that they provide, and not only for what they're doing for their patients, but what they do for their staff, and really kind of working really towards just continually improving what they do. And I think this culture that they've got in place is very, very conducive to what we've tried to accomplish in kind of changing the culture of accreditation and how it really kind of fits with what they're trying to do, what they're trying to accomplish. Instead of really suppressing innovation, creating a means for it to be more active with what they do, a big part of how they're kind of improving upon that success. And when we've kind of talked with different hospitals and asking about why think about changing accreditation organizations, what's it really mean to you, and some questions that we pose to them, why to do something different? What are you really looking for from an accreditation organization? And so when we talk about the survey to be more meaningful and more consistent, they want it to be something that we can learn from the surveyors and how can we do better, not just inspection oriented, but how do we get away from kind of that preparing for survey, talk about what we're doing, how we're doing it, and how we can improve in that perspective as it relates to compliance strategies and really kind of bettering the care that we're trying to deliver on.
For me and for our CEO was a pivotal moment when we knew that we had been successful in instilling a culture of transformation, of innovation, and of accreditation. We had at the annual survey a number of units that were communicating with the command center and with our chief nursing officer, who were asking where the DNV GL surveyors were. Not because they wanted to go hide, but because they were asking why they hadn't come to their unit yet. So they were proud to show off what they had done, their innovation, and what they saw as opportunities for improvement with patient care.
You've been listening to a brief excerpt from the Creating the Hospital of the Future Through the Accreditation Process webinar, sponsored by DNV GL Healthcare, recorded on April 4th, 2018. The full webinar included discussion from Patrick Horan, President and CEO, DNV GL Business Healthcare, Jose Perdomo, Senior VP, Chief Ethics and Compliance Officer with Nicholas Children's Health System, Marisol Castro, Director of Accreditation and Regulatory Compliance with Nicholas Children's Health System, and Neil Salem, Chairman, President, and CEO of NISA Solutions. Feedback from the live webinar audience included accolades such as great experience and good info with data, informative, and I appreciated the opportunity to learn more about DNV as we are considering this accreditation process too. You'll want to be sure to watch the full 1-hour webinar video. To do so, click the link to the full video that should appear in the narrative provided when you selected this excerpt video and which also appears now on your screen. Thanks again for previewing this session, and we do hope you will join us for the full 1-hour video using the link provided.